So let's talk some genetics. First of all, we have to familiar with the genetic terminologies. And the first terminology is the codominance. Co means together. It means both allele must be present and to express. And dominance mean to express the phenotype. So both allele must be expressed together to give a particular phenotype. For example, in a classical example of ABO blood system in which the A allele and the B allele both codominantly express to give AB blood group. Other low yield examples are HLA-N anti-alpha 1 antitrypsin deficiency. So in these expression of both alleles, neither allele mask or block the effect of the other allele. So this is a compulsion. Then we have after codominance, we have variable expressivity. Variable mean different. Expressivity means expression of the allele, or in regarding to genetics, expressivity goes for phenotypes. So variable expressivity mean different phenotype but same genetics. And the example for this variable expressivity is neurofibromatosis and Marfan syndrome. Both in neurofibromatosis, for example, there are two patients or two or more patients. Both of the patients have the same genetics for neurofibromatosis, but their presentation may be different from one another. In one patient, there is one or two major symptom of neurofibromatosis, and in the other patient we have a very severe condition in which it has multiple phenotypes. So this neurofibromatosis and as well as Marfanoid syndrome or Marfan syndrome can elaborate variable expressivity. In Marfan syndrome, also there is one case which is the least severe or mild case. We have tall hepatis, and in another case we have rest of the features of Marfan syndrome like aortic root dilatation, etc. So after variable expressivity, we have incomplete penetrance. Incomplete penetrance mean there is incomplete expression or penetrance or of a disease to express. For example, let me explain with an example. Incomplete means not 100%. Let's explain this with an example of BRCA gene. So it tells that not all patients, not all humans having the BRCA gene can express ovarian or breast cancer. So the BRCA gene goes with this incomplete penetrance. So not 100% BRCA patient express cancer. Along with BRCA, we have also hereditary hemochromatosis, as it will show on it showed in the UWorld questionnaire, and also the titin gene expression of dilated cardiomyopathy. So in both of the diseases, we have the hereditary, we have the defective gene, but this gene is not 100%ly expressing its disease or expressing its effect. So there is a formula in which we can calculate the risk of probability of developing cancer, risk of probability of developing cancer, that is the percentage of the penetrance multiplied by the probability of inheriting, the probability of inheriting the genotype. So incomplete penetrance is actually number of patients with symptoms divided by number of patients with genetics or with genotype, and it will give penetrance ratio. So codominance, variable expressivity, then we have incomplete penetrance. Next we have the pleiotropy. Pleo pleo means different. Tropy means trophism or trophic effect, means effect. So one gene, multiple effects. One gene, multiple effects. And in this particular terminology, uh, phenyl ketonuria, it expresses phenyl ketonuria gene defect. So one gene, different effects, including the musty body odor, then intellectual disability, and also the light skin color. Then we have anticipation, my favorite. Anticipation goes to directly to the example of trinucleotide repeat expansion diseases, especially the Huntington disease. So the anticipation definition is increased severity or earlier onset or earlier age of onset in the successive generations. Means the father is affected at the age of 60, and in this particular example of Huntington disease, the father is uh, the father is affected at the age of 60, but his son is affected at the age of 30. So this Huntington disease increase in severity, and earlier this criteria fulfill, and the severity in the uh, child of that father, the severity may be increased successive generations. This is an example of anticipation. Then we have heteroplasmy, another board's favorite. Hetero means different. Plasmy goes to the organelle. So in heteroplasmy we have Different organelle. What organelle? Different mean both normal and mutated. Which organelle? Mitochondrial DNA, which goes to the respective generations from mom to all the siblings or all the children. Sorry. So normal and mutated DNA, these are heteroplasmy and goes from mom to all children, and it follows in the especially in the mitochondrial inherited diseases, especially uh, the MERV, that is myoepileptic disorder with the raked muscle fibers and heteroplasmy, and it will show variable expression or expressivity due to the and this heteroplasmy occur during mitosis. This line is from UWorld. So heteroplasmy, then we have in heteroplasmy we have the MERV, then we have albinism, and also we have the familial hypercholesterolemia. So heteroplasmy, oh sorry, these two are related to locus heterogeneity. There is a terminology, it will described in this segment: locus heterogeneity and then allelic heterogeneity. Heterogeneity means different, geneity means related to genetics. So there are two, locus heterogeneity is the high yield one, and the allelic heterogeneity is the low yield. So locus and allelic heterogeneity show same phenotype, and these phenotypes are albinism. These phenotypes are familial hypercholesterolemia and morphonoid habitus, or morphonoid habitus. So same phenotype as I described the examples, but the difference in the locus and the allelic is, in locus there is a same mutation, but at different loci or different places. Like in morphonoid syndrome, we have a same phenotype, morphonoid habitus, but its heterogeneity or heterogeneity is from it can morphonoid syndrome have the differential diagnosis of homocystinuria and men to be syndrome, multiple endocrine disorder, and endocrine neoplasia, I guess, and then we have Marfan syndrome itself. So these three have mutation at the different loci, but they give the same phenotype. As in contrast to allelic heterogeneity, there is different mutation at the same locus. So there is allelic heterogeneity, there is a different loci, mean there is a different loci, heteroloci, but the same mutation. And in the allelic heterogeneity, there is alleles are different. Okay, so the loci is the same, but the mutations are different mutation. So in the allelic heterogeneity, we have the example of beta thalassemia, and in beta thalassemia we have the mild, the moderate, severe, and all that, the heterozygote and the homozygote. Then after this we have the low yield terminologies, that is loss of heterozygosity, and it is very much important in the cancer carcinogenesis, especially the Kuhnsen hypothesis. So in loss of heterogeneity, for example in Lynch, in live remaining, and also in retinoblastoma, we have inherited or mutated allele in a patient. So the complementary allele for this mutated or inherited allele, the complementary must be deleted or mutated in order to get cancer, or in order before cancer develop. So this is the definition of loss of heterogeneity, and it is especially the common or typical example of this is the Lynch in live remaining and retinoblastoma. And next is linkage disequilibrium, or there is a disbalance of the linkage alleles. So tendency to occur more or less than expected when certain alleles, more than two, certain alleles, they are at two linked loci inherited on same genotype, then there will be a linkage disequilibrium. And the last one is dominant negative. Dominant means it exerts dominance effect, like our angry cute little girlfriend. Dominant mean it shows dominance. Negative and mutation, negative mutation. So mutation means there is a mutation in a heterozygote mutation, which can form an altered or non-functional protein, and this protein exert a negative effect, that it prevent normal gene products from functioning. And the example for this is p53 tumor suppressor gene mutations, in which a single p53 mutated protein is actually non-functional. It binds to DNA, and also it prevents the normal p53 binding at the DNA to function. So this is all about genetic terminologies and their examples. In the boards or in the step 1 we have a questionnaire questions regarding the examples, and then they will be asked about the terminology, that in genetics this example show which terminology, like in BRCA BRCA show incomplete penetrance, anticipation, especially Huntington disease follow anticipation, and then pleiotropy, PKU, and other. So these are all the examples of example and terminologies, their importance in the step 1 exam. The next we have a mosaicism, and we will describe mosaicism as a separate entity with McCune-Albright syndrome and uniparental disomy. We can explain that terminology with the parietal eye disorders, and these terminology, then the terminology discussion will be over.